and thank you for being here. My name is Jennifer Williams, and I am one of the co-executive directors here at the NLN. I am thrilled to kick off this year's Lymphedema Treatment Symposium. We are so excited to have you with us for this two-day event filled with education, connection, and community. This symposium is designed to provide general information and resources to help you better understand lymphedema and its management. While we hope you find the sessions informative and empowering, please remember that this is not a substitute for medical advice. For personalized recommendations and care, we strongly encourage you to consult directly with your healthcare provider. I just want to take a moment to say thank you to two of our gold sponsors, Medi and Jobst. These two companies have been staunch supporters of the NLN for many years, including supporting the NLN Garment Program, and are also sponsors of our new program in 2025 called NLN Start Strong, which is a mentorship program and resource for newly certified lymphatic therapists. Now let's begin. So I would like to start the symposium off by talking a little bit about what lymphedema is and what it isn't, so that we get a better understanding of how to recognize it and why it happens and how it can affect daily life. I hope that you'll also understand and discover the leading treatment for lymphedema and how it empowers patients to take control of their care. So the first thing is we have to talk about what lymphedema is. And so lymphedema is a disease of the lymphatic system, which is part of the immune system. The lymph vessels and lymph nodes can be missing or impaired or damaged. It's important to note that lymphedema is a disease. And the definition of a disease, is an abnormal condition that affects the body, often with an identifiable cause and mechanism, as in when the lymph nodes are removed. So now we have taken part of that lymphatic system out, and therefore the system is no longer working as effectively as it once did. This is compared to edema, or often called swelling, which can be a symptom of something else, such as heart or kidney disease. This is often why doctors will run multiple tests and blood work to determine if the causes stem from other diseases, such as heart or kidney, or even a blood clot. So lymphedema, by definition, is a buildup of protein-rich fluid in one or more parts of the body due to the damage or missing pieces of the lymphatic system, and causes chronic and progressive swelling within that area. Lymphedema often presents asymmetrically, or meaning one limb or region is more affected than the other. And I just want to make a note here, please do not stop eating protein. That will not reduce or prevent lymphedema. In fact, sometimes, not getting enough protein in your diet can lead to swelling due to other issues such as malnutrition. And finally, there are many different causes as to why lymphedema occurs. In the US, the most common causes include oncology-related treatment and surgery, or the cancer itself, infection, obesity, and trauma or other surgery. So symptoms. So these are the four major symptoms of lymphedema, but surely there are others out there that individual people may experience. So we talk about swelling. So this typically with lymphedema starts at the end of the limb, which is furthest away from the trunk, such as your hand or the foot, and slowly will, gradually move up the limb as it progresses. Facial swelling often begins, sometimes people see it under their chin or in their neck, and truncal swelling can vary depending on the body part affected. Heaviness, so because of that fluid beginning to build up in the limb or the body area, and it's increasing in size, imagine the weight that it causes and how much that, how that person can report that heaviness. And additionally, people may experience heaviness towards the end of the day, especially in their legs if they've been up and walking and moving all day and they don't have the proper compression on. Discomfort. So people report varying levels of pain in the region of lymphedema, which could be related to a combination of the symptoms of the swelling and the heaviness and skin tightness. But it also could be something that's an underlying issue, such as a muscular joint or neurological issue. Sometimes scar tissue can cause pain as well. And finally, skin tightness and changes. So as the fluid slowly builds up in that area, eventually there's going to be enough swelling that the skin has to start stretching as the body runs out of space. And this will often lead to feeling like the skin is really tight. It can also manifest as skin tightness when you touch the area. So for example, our skin naturally has a stretch to it. And so, if you try to, move your arm, your skin back and forth, you can see that it has some nice stretch. Or if you try to move your finger, the skin on your finger, it doesn't quite stretch as much. But in any case, as you, excuse me, I just lost my screen here. Let's try that again. Okay, in any case, eventually as the skin starts, as the swelling progresses, the skin starts to stretch itself, and then the stretch in itself will decrease over time, as well as the skin integrity will change and lead to thicker and harder skin that may also change in color in some cases as well. Okay. So there are two types of lymphedema, primary and secondary. And so this is a very basic overview. So primary is typically caused by a genetic or hereditary issue, and symptoms can be either present at birth or in later adult stages. There are different types of rare conditions such as Milroy's or Mayish disease that can cause lymphedema, and are often associated with that the lymphatic vessels are absent, so they're not there, or they haven't formed correctly due to an altered process within the system during development. And this type of lymphedema is typically less common, though not less important. The other type of lymphedema is secondary. So it's caused by damage to the lymphatic system due to some of those reasons I had mentioned earlier, such as oncology treatment, obesity, infection, trauma. The person's lymphatic system may have been properly developed as compared to primary lymphedema. However, now there's something that has occurred in the system, and the lymphatic system is no longer able to function as it should. So this can occur at any age and is the most common type of lymphedema. There are different types of imaging options and genetic testing that can help determine which type of lymphedema a person may have if it's not obvious, such as my mom has a swollen leg too, or maybe the person had lymph nodes removed, or they were in a bad car accident, which created significant trauma to the limb. And those are things that we can say, oh, that's what triggered the lymphedema. Okay, so stages of lymphedema. So there are different formulas out there in regards to how people classify the stage of lymphedema or the progression, but this is one that is commonly used, so 0 to 3. So the disease process of lymphedema starts at stage 0, where that pink or purple box is, and progresses until stage 3 if left untreated. People can experience different timelines of progression from one stage to the next, and it can also depend on other factors such as early or late diagnosis and if the treatment has been initiated early or not. So stage 0, fluid begins to build up within the tissues of the limb or the body area, but we cannot see any swelling when we look at the area. So therapists will often measure with a measuring tape during, an evaluation or throughout treatment. And, when someone is there, they're going to compare the right and the left arm, for example, and there's not going to be any significant differences, or you're not going to feel any of those differences, but that person internally feels heaviness, discomfort, maybe even some skin tightness. I once had a patient who said it felt like a puzzle piece of her body, and proceeded to kind of outline where her symptoms were, which correlated exactly to how the drainage pathways of the lymphatic system in the body are structured. However, like I said, when I measured her in the clinic, I couldn't feel any swelling, or, the arms weren't significantly different. And so often the way that we formally diagnose the stage is by using imaging or other technology that can determine if there is edema in the area. Additionally, this is the ideal stage, of when healthcare professionals would like to begin treatment, as the outcomes are significantly better than someone in the later stages. More and more clinics are and oncology centers are implementing screening processes for this particular reason. So stage 1, this is where people start to see that swelling occur, and it's often associated with pitting edema. So what we mean by pitting edema, if you haven't heard that, is when someone pushes their finger or thumb into the tissue and holds it there for a length of time before removing their finger, and they lift it up, and a small divot or pit, a little divot remains. That is considered pitting edema. And so there are different degrees of pitting which can determine how much swelling is present. This stage is spontaneously reversible, is what they call it, because the one thing to note is that elevation at this stage will often help to decrease the swelling to a point where their limb shape returns to normal, quote unquote. Like when people say, when I wake up in the morning, my feet and ankles are normal. Again, treatment at this stage is really important, because if it was not diagnosed at stage 0, as once again, the disease has progressed not to a point where there are permanent changes that can be associated with lymphedema, and the results for treatment and long-term management are often more ideal. So stage 2, this stage is referred to as spontaneously irreversible, meaning that the swelling is constant, it never goes away completely, and that elevation does not affect the swelling as it once did. So that might be when someone says, well, I go to bed at night, my legs are really swollen, when I wake up, it gets better, but doesn't really actually quite go away. This is also where some of those skin changes start to occur, such as discoloration or that less stretch of the skin, hardening and thickening of the skin. Pitting or divot is less, but that doesn't mean there's less edema or swelling. It just means that maybe the skin and tissue changes that are occurring within that area are changing, and things are becoming more firm. And again, treatment is very important at this stage, though it is more intensive, requiring full, what we call complete decongestive therapy, which we'll discuss in just a few minutes. And finally, stage 3, so that is the most advanced state of lymphedema. The swelling is constant when left untreated. The skin is hard and fibrotic. Often people who have lymphedema at this stage have a really high risk for infection and wounds. And intensive therapy is important, and also in some cases may require surgery to help return that limb or area to a more typical shape and size. Just a quick note about surgery. There are surgical options for lymphedema at any of these stages. However, it's important to know that while it is very effective, it does not cure the disease. And most often doctors will want you to go through the treatment prior to surgery and also be compliant with compression, that pesky compression. So more of what lymphedema is. So possible complications. So people have an increased risk for infection, so cellulitis or fungal infections. And remember that the lymphatic system is part of the immune system. So if that area, that part of the lymphatic system is not working properly, the immune system will also be impaired, and then healing will be delayed. We talked about skin changes and wounds. Mobility impairments, such as if it's their arm, they have difficulty reaching up over their head and maybe brushing their hair, or walking if their legs are affected. Someone that has swelling in their neck might have difficulty turning their head or even swallowing. And for example, someone that has breast swelling might have difficulty lying on their belly or wearing a seatbelt in a car. So fatigue is often associated with lymphedema, though less commonly acknowledged. So think about how when someone is having to use more energy to manage or move the limb around, and how they might not be able to sleep because of discomfort or positioning issues. Additionally, the lymphatic system is responsible for removing waste products. And if that fluid is sitting in the body, the inflammation in their system can create a toll on the body in general and cause fatigue. And also distress, so emotional and body image concerns. Anxiety and depression and withdrawing from social situations can certainly affect people, with this condition. So I also wanted to add in these last two possible complications because I think that they are complications. So as I was doing this, I looked up the definition of a complication because in my head, I'm thinking of all these other things that kind of happen when someone has lymphedema. And it is defined as a secondary problem or condition that arises during the course of an existing illness, making the situation more difficult to manage. So finding clothing and shoes that properly fit around a larger limb can be difficult in a lot of cases, which can make managing their lymphedema difficult. So if someone can't find the proper shoe wear, or they're forced to wear, like say they have it in their leg and they're forced to wear a flip-flop or an ill-fitting shoe, that can make their swelling worse, or set them up even for a higher risk of infection or wounds if they get a cut or bacteria. And also financial concerns. People with lymphedema have to wear compression garments daily, sometimes day and night, and replace them every 6 months. So with insurance copays and deductibles, the cost of this alone can be straining. Not to mention if someone is hospitalized due to an infection or wound, they might have to take time off work, or even if they have to go to therapy. And this can make it all the more difficult to manage their lymphedema effectively. So I definitely consider those to be complications. Okay, so I love this picture because, it's that little, child covering their ears and they don't want to listen to their parents tell them and what they're, trying to teach them or what they're saying. And I want you to kind of think about this because if somebody says these things to you, just say, no, that's not true. That's not true. So for example, what lymphedema is not. So it is not just simply water retention or just swelling. So we talked earlier about how it's chronic progressive disease and that something that should be addressed and treated as such, and it will not go away on its own. It is not curable, but it is definitely manageable. So even in the late stages, it can still be managed with proper treatment and self-management. It cannot be resolved or fixed with medication, elevation, or those socks alone. So currently there is no medication approved by the FDA that will effectively address lymphedema, though there are researchers looking into this. We talked about how elevation can help in the early stages of lymphedema, that does not resolve the issue completely because once a person gets up and starts walking around and living their life, the swelling comes back. And socks, or compression socks, as people like to call them, cannot resolve the swelling by itself. It is important to receive the proper treatment and have a trained therapist apply that treatment. And finally, it is not something you just have to live with. I have had many patients come into my clinic and tell me that their doctor said there was nothing they could do except live with it. And we know that is not true and that there is treatment available. So I just want to quickly touch upon two of these other medical conditions that people often confuse lymphedema with. We've already talked about the characteristics of lymphedema, which is that middle picture. And you can see that the left leg is larger than the right. There's swelling that starts in the toes and it progresses up the leg. It looks like there might be some skin changes this person is experiencing, but that is what we would consider lymphedema. So the picture on the left side illustrates something called lipedema, and they sound very similar, but they are not the same thing. Sometimes people call one thing the other. So lipedema is an abnormal accumulation of fat tissue, typically within the legs, though the feet are often not affected. So if you can see that picture, you can see that their feet look pretty typical, but that their legs have, an abnormal shape and look almost like cellulite, but it is not your typical cellulite. And sometimes, I've said, we kind of look at the waist down in this situation just because of the different types of lipedema that can present, whereas lymphedema starts at the foot or the hand and goes up. So one thing to note is that as lipedema progresses, lymphedema can develop, but you cannot get lipedema from lymphedema. So there is lots more to discuss about lipedema, though for purposes of this event, we're going to stick to talking about lymphedema. So the picture on the right displays someone who has venous insufficiency or chronic venous insufficiency. Sometimes people call it CVI. This condition is in which the lymphatic system is working normally, though there is a weakening of the veins in the leg. So the blood can't return back up through them as they once did. And swelling is often associated with this condition and can trigger a lymphatic issue because the system becomes overwhelmed with the additional workload it has. So significant discoloration and other skin changes can occur due to the venous impairments. So there are different treatment approaches to these conditions, and therefore it's important to understand that you're properly diagnosed and receive the correct care. So I'll only touch upon this for lymphedema, as our next speaker is going to talk about this in more depth, but I want to point out that the NLN recommends the gold standard of treatment for lymphedema, known as complete decongestive therapy, or as it's been referred to, CDT. So this is a combination of different types of treatments, such as manual lymph drainage, compression, skin care, education, exercise, and self-care. It's also recommended that CDT be performed 5 days a week for effective and ideal treatment and outcomes, especially for intensive treatment. So this chart, while it looks a little confusing, demonstrates the two basic phases of CDT, and I'm not going to go into this, but the maroon side is part one or phase one, excuse me, and is often called decongestive phase or active phase or reduction phase. And the second part, the gray circle, is the maintenance phase or the self-care phase. And these two are intertwined because this is a chronic condition, and oftentimes you'll hear really good lymphatic therapists say, I don't discharge my patients. I keep them forever and ever. And that's because of, like I said, a chronic condition that needs follow-up, just as you were going to your primary care every year for an annual exam. It's important to make sure that you get fitted for new garments, that someone is checking on how things are going for you. Are you managing everything okay? And really being sure that this is being addressed properly. So that brings me to your interdisciplinary care. So that little chart there shows a bunch of different healthcare professionals surrounding you, the person, the patient. And of course, at the top there's your lymphatic therapist. And then as you go around in a clockwise manner, you'll see all the different professionals that may be involved in your care, or ideally you would want in your care. So the primary care physician, a specialty physician, such as a wound care doctor, or oncologist, cardiologist, podiatrist, nephrologist, all the ists, a social worker or case manager to help with some of those resources and coordination of care. You're a surgeon, and it could even be an orthopedic surgeon. Maybe there was swelling that was caused after a knee replacement. Nutritionist, so we talked a little bit about that protein and making sure that you're getting that food that's important for supporting lymphatic health, but also anything else that your doctor recommends for your own personal situation. Possibly even a mental health professional. And so we talked about distress and some of those other quality of life issues. And often it's a good resource to go and meet with someone that can help you work through that. And of course, your own personal support team. So someone in your corner who you can count on at home, or your friends, or someone that you can just talk to or live life with. So you might have other parts of people in this team, but for the overall, it is really important to make sure that you have this nice range of people in your corner. And the reason for that being that the overall goal is that you have sustainable management for what your personal situation is. And so, if something does occur, you're able to reach out to the appropriate person and receive that care more timely and effectively to manage those symptoms. You'll feel better overall, as compared to someone who doesn't have maybe all these team members or doesn't know who to go to, or doesn't have the information of where to even start. And so there has been research done on this. And so, people with a good care team also have lower healthcare costs with copays and therapy and medical bills, hospitalizations. They don't have to take time off of work as much. And if they have someone that is the correct person to go to, the issue can often get addressed faster, which I already said, and can improve recovery times with access to the appropriate treatment, referral, resources, therapy. Excuse me, I've lost my screen. There we go. So quickly, just some common myths. So again, put your hands over your ears and refuse to listen. If it doesn't hurt, it's not lymphedema. So the presence of pain or lack of pain doesn't determine if someone has lymphedema. It's based on all of those other things, and more that we've talked about. Only breast cancer patients get it. So we know that this is simply not true. So as discussed earlier, there are a number of reasons of why lymphedema can occur, and it's not just breast cancer. Breast cancer has gotten a lot of attention with research and obviously it's a high prevalence in our society. So it does get a lot of attention, but that is not the only reason why people get lymphedema. Massage solves the problem. So while manual lymph drainage is often called massage, it is not technically massage, nor can it solve the problem alone. It involves those other parts of CDT that are combined. So exercise or carrying heavy items causes lymphedema. So this used to be something that people were told after a lymph node removal surgery, for example. They said, don't carry anything more than a gallon of milk. So more research has determined that exercise and controlled weightlifting can actually improve symptoms, and movement is a very important part of CDT in relation to how the lymphatic system works in general. Just wear those socks. So again, those compression socks are not going to fully address the issue, although they are an important aspect of management. CDT is the solution for reduction and management overall. Just keep your feet up as much as you can. I can't tell you how many times I've heard this. And while we've talked about how elevation can affect different stages with lymphedema, it's not the only thing you should do. We know that movement and exercise is important, and also the whole body in general. So you need to live your life. But if you happen to be sitting down, put your legs up, but don't spend all day doing that. And something is better than nothing. So the only thing that's good for lymphedema is proper treatment and management of lymphedema, and that is the only way to approach your care. And so the more you know. I remember that TV spot a long time ago, and I'm probably dating myself a little bit, but where it would, come on and people would educate, and then there'd be a star across the, galaxy, and it would say, the more you know. But truly, knowledge is power. And understanding your condition helps you to take control of lymphedema and control over living your life the way you want to. Be your own advocate. If you're not happy with the answers that you're getting from your healthcare providers, get a second opinion or continue to ask questions. Keep bringing it up because you deserve the care you need to manage your health the way it should be managed. Or if you're a friend or loved one with, who knows someone that has lymphedema, be their advocate. Help them find the right treatment or resources to get the care they need. So just a side note, that little image there with the tree, and it says Lead Lymphedema Education, Advocacy, and Development. The NLN will be launching this program hopefully later this year or beginning of next year that will help people become advocates within their own communities. So you can find more information about that on our website. Tap into trusted tools and support. Organizations such as the NLN can offer education and resources, as well as other trusted healthcare providers who may be more knowledgeable about lymphedema, and they can be your go-to people for more information. So please do not Google your symptoms. But the good news is you have already begun to do this just by being here this weekend and increasing your knowledge and learning about resources that you can use to advocate for yourself or others with lymphedema. So I just want to end with my favorite quote, which is, be the change you wish to see in the world. Be that change. If you're not happy with the way things are going in your own world, be that change. If you see someone else that may be struggling with something, be that change, be kind, be an advocate. But thank you again for being here. I was diagnosed with lymphedema in 2021, but recently diagnosed with lipedema. Much of this information seems pertinent to me. Should I continue watching? So yes, I'm going to say yes. Anyone that has swelling, actually, even if they don't have a diagnosis yet, I'm not saying that they have lymphedema or lipedema. I'm just saying that this is a good resource to start to learn about what potentially treatment is out there, and just getting your knowledge so that if you are diagnosed with something like this in the future, or you're not getting answers you want, asking your healthcare professional about the different options that or conditions it could be. Okay, so looks like someone is asking me about Lasix. So Lasix, or diuretic, that is when, that is a medication that is essentially used for, in the general aspect of removing water from the system. I'm using water with a really loose term, just so that I'm not confusing people. And it's really actually effective with the venous system. So we have veins and arteries in our tissues, but unfortunately, it has not been proven to show an effective reduction in lymphatic fluid. Now, I am pleased going to state that do not stop taking your medications if you are on this. You need to talk to your doctor, because they are used for other reasons, and not just for trialing to get rid of lymphatic fluid. So do not stop taking these medications, but knowing that this alone is not going to be the end all, because like I said, there's no effective treatments, medications for lymphedema at this time. Let's see. I have lymphedema in both legs, and I am not able to sleep on my stomach. How do I know if the condition has progressed? So that would be something I would ask your healthcare professional about, because getting the proper diagnosis and monitoring your symptoms, either by your therapist or your doctor, or as you're moving through self-management and checking in with these that care team that I was talking about, that will help you. Also, if you're experiencing any changes in how you're feeling, or how you feel that your swelling is presenting, it's always good to, again, follow up with those that are on your team. So without further ado, I'd like to take a quick 5-minute video to show you from our friend of the NLN, Lisa Sylvestri. She is a physical therapist and lymphatic therapist in California, and she has prepared some amazing breathing and stretch breaks, and I will let her take over from here.
Good morning and welcome to your interactive breathing session. We are going to focus today on diaphragm breathing, and I want to make sure that everybody knows how to do it, but also knows why I like doing this exercise so much. Our diaphragm muscle sits underneath our rib cage, separating our torso into an upper and a lower half. And this is important to understand because the motion of our diaphragm muscle while we are breathing is going to create some movement within our rib cage, and also create a bit of a negative pressure, which is going to help pull fluid from our lower body into our main lymph vessel and back up into our central circulation. So if you understand this anatomy and you understand the function of what the diaphragm muscle is doing as our primary breathing muscle, we can start by doing some diaphragm breaths. What I'd like everybody to do is take one hand and put it on your chest, and the other hand and put it on your stomach. When we're doing these breaths, you're going to feel your stomach come in and out, But remember, it's actually the muscle underneath the rib cage that's doing the motion. So first, just take a few normal, relaxed breaths. Feel the air come into your body and into your lungs, and the rise and fall of your chest as well as your tummy. Now, for the next inhalation, I want you to focus on breathing all of that air in and putting it into your tummy. So as you breathe in, your tummy or your abdomen should come out further than your chest wall. So breathe in and fill your abdomen with air. And then exhale and let all of the air out of your belly and your lungs. And again, breathe in and fill your abdomen with air. And exhale. Let all of the air out of your abdomen. So again, breathe in and fill your belly with air. And exhale, breathe out through your lips. And empty all of the air out of your lungs and out of your abdomen. As you continue to do this, you are getting the benefits of improved lymphatic flow and fluid movement throughout your body, but perhaps you are also going to notice that you may feel a little bit dizzy while performing this exercise. Remember, we're taking oxygen in a little bit differently than you do normally, so this is sometimes an expected side effect that people encounter. So if you are feeling dizzy, I want you to stop right away. Remember, our diaphragm is a muscle, and the more we train it and exercise it, the better we will get at using it. So you might be able to only do 1 or even 2 diaphragm breaths. I want you to try practicing this throughout the course of the day. And as you're doing this, you may notice over the course of just 1 day or 2 days or many days that this is an excellent exercise to help promote lymph flow, but only if you can do it safely and without getting dizzy. When you're doing the breaths, I want you to go nice and slow for the inhalation and nice and slow for the exhalation. Continue to do this to help relax yourself, as well as there are connections between our diaphragm muscle and our parasympathetic nervous system, which will keep us cool, calm, and collected as we get through the day's program. This is how our diaphragm muscle is going to be used most effectively for breathing exercises and for lymphatic flow. Thanks, and I'll see you later.
With a deep commitment to advancing health equity in lymphedema care, this speaker brings you years of clinical experience, leadership and program development, and a passion for overcoming barriers in practice. As a certified lymphedema therapist, educator, and advocate, she continues to shape early intervention strategies and elevate standards of care across settings. I am honored to introduce Bethany Beckwith. Thank you, Bethany, for being here today and for talking about demystifying lymphedema therapy. All too often, people come in, and especially in, treating, they would say, I don't know why I'm here. The doctor just said you were going to give me socks or give me, some massage. So I appreciate you being here.
Thank you for having me, and I'm so glad that you're all here to join me as I'm going to talk about lymphedema therapy and what we do as clinicians and what you can expect as you start your lymphedema therapy journey. So by the end of this presentation, you will be able to identify 4 components of complete decongestive therapy. And hopefully you'll be able to describe at least 3 basic standards or goals of lymphedema therapy. So to begin, who are lymphedema therapists? Probably the majority of lymphedema therapists are physical or occupational therapists. There are speech therapists that will address lymphedema of the head and neck. And then massage therapists can also be certified in complete decongestive therapy. And doctors and nurses can also go through the course and be certified. Depending on the state and their clinical availability, they might get the certification more for knowledge base than actual billing and doing the therapy. So again, that depends on the state that you're in. Some of the possible settings that lymphedema therapy can occur in might include inpatient. So this might be in acute care or rehabilitative care or even residential care. Some therapists will provide in-home therapy. And then the majority of clinics are probably outpatient clinics. The cost of lymphedema therapy can be private pay. Some clinics might prefer cash-based, and then there's going to be clinics who will bill insurance. And in order to bill insurance, you might need a referral from your physician. So during your therapy evaluation, your clinician is going to assess your medical history. So they'll want to know about any medical events that might be significant in the cause of your lymphedema. And they're also going to want to know about any comorbidities or any other health conditions that might affect your therapy intervention. They will want to know about your social history. So your living situation, any social supports or health partners that can be able to assist in lymphedema therapy. They might want to know about your commute and if you have reliable transportation, and what kind of like other caregiving or schedule obligations that might interfere with lymphedema therapy. We'll also want to know about insurance coverage and any financial barriers. We'll assess your physical function. So that might be things like your strength, your range of motion, your coordination, and any orthopedic limitations or restrictions. We'll want to know about any pain that you're having and the sensation that you have in your skin and in your, especially where the lymphedema is. We're also going to look at your skin integrity. So we're going to take a look at the texture of your skin, the hydration of your skin. We're going to be looking for any open sores or areas where there's weeping. We're going to know any areas that we might have concerns for infection. We're going to look for scar tissue or fibrosis, which is that hardening of the swelling that Jen talked about. And then we're going to take measurements of the affected body part. These are typically done by like a flexible measuring tape, but there's newer, higher technologies that are becoming more available that will help give us an idea about the volume of the affected body part. Whoops. So for the evaluation, I would recommend that you bring a social support or health partner. It definitely helps to have a second pair of ears to hear everything and give some feedback. Bring any current compression garments that you're wearing or using. A therapist might want to assess how effective they are, how old they are, and go forward from there. And definitely wear any kind of loose fitting clothes that would be easy to remove, because we want to see that skin. We have to assess the full body. So planning for treatment, Jen talked briefly about complete decongestive therapy, and that's the protocol that we're certified in. It comes in 2 phases. The first phase is intensive decongestive phase, and it's called intensive decongestive because it can be intense. It does call for daily attendance to therapy, complete with multi-layer bandaging, which I'm going to show you in a few minutes. And depending on the stage of your lymphedema or the body part that's affected, that phase can last between 2 and 6 weeks. As a person decongests their swelling, we might decrease the frequency, and as you transition into more like symmetrical limbs, then we're going to transition you into independent management phase. And in that phase, you can transition into more maintenance garments, and you start to self-monitor and self-regulate your swelling. So some things to think about when planning for your treatment is definitely scheduling. Because it does call for daily therapy, we would probably want you to consider booking out a few weeks, scheduling out a few weeks in order to pick a time slot that matches your daily routine or your work schedule. We would probably consider getting you like a medical note or talking to your employer about taking time off for work for this intensive decongestive phase. And so we can work on you there. Most clinics are they'll work with whenever you're able to come in. You also want to think about your support person schedule too, and make sure that they can come in for at least the first week. We definitely want to plan for transportation, so making sure that you have reliable transportation. You can seek public transportation assistance, insurance coverage. This is something your clinic should know. They would definitely want to know how much your insurance is going to cover in types of visits or how many visits. And that's more for the clinician to kind of navigate, but it always helps for you as a patient. If your insurance gives you a hard time about how many sessions therapy wants to do with you, it always helps if you can call your insurance and tell them how important it is for you to come to therapy daily. And then you want to think about financial planning. Definitely, if you're going to a private pay clinic, that could be a cost. And you also want to consider copays or deductibles or anything insurance doesn't cover for garments. You want to plan to save money or fundraise, or if you're going through a larger hospital system, you could seek financial assistance through that system as well. And then you definitely want to plan to have a social support there. So a spouse, a partner, kiddo, or a parent, somebody that would be able to come into sessions and learn the techniques, learn the complete decongestive therapy components with you. So now we're going to step into the room as I treat a case of someone who has both upper and lower extremity lymphedema. So here you can see that I'm using one of those flexible measuring tapes, and I'm taking measurements at certain parts of the affected limb, and this helps me to monitor the volume changes. So through complete decongestive therapy, we would expect to see those measurements decrease as therapy goes on. And here I'm doing the same thing for the leg. So the first component of complete decongestive therapy is skincare. You can see that I'm inspecting her skin while I'm washing her skin. I'm using just regular soap and water, and I'll wash her arm, in between her fingers, around her nail beds. I will do the same thing on her foot and leg as well. And I'm also applying lotion. So lotion is a very important part of skincare because as your leg swells or your arm swells, that swelling decreases the nutrients from your blood that's actually reaching the exterior skin. And so by lotioning, we can keep your skin hydrated and moist so it's more stretchy. When skin dries out, it can formulate cracks, which allow in risks of infections. And so the next part is manual lymphatic drainage. And this is a manual activation of the lymphatic system. It's a gentle skin manipulation that stretches and stimulates the lymph vessels and helps them to pick up and circulate lymph fluid more effectively and faster. You can see that I started on her core and then worked on her neck and chest. And then I'm slowly moving section by section down the arm. So we work on the lymphatic system that's closest to the body, and then down the arm or down the leg. You'll see the video of me doing it on the lower leg as well here. And so I have a lot of patients who ask, why don't we just start where the swelling is? And it's a great question. And I explain it like this. Your lymphatic system is like a highway. Everything in the lymph fluid or the lymph vessels want to travel up the body. So up the leg, up the arm, it all wants to go back to your heart. So when there's been a lymphatic insult or injury, it's kind of like a car accident on the highway. We have to clear the debris. So we have to work at the central location, the core, the hip, the underarm. We have to clear the debris, create detours before we can get that traffic jam flowing better all the way through. So once we get all the way to the foot or hand, we do work all the way back up to the body. The third component of complete decongestive therapy is compression bandaging or multi-layer bandaging. We use multiple layers of bandages for the compression in this intensive decongestive phase. The first layer on her arm right now is a cotton stockinette, and that just serves as a protective layer against the skin. And then we use elastic gauze rolls for the fingers or toes, which you can see that I'm doing that now. And that's to prevent any swelling from being pushed into the fingers or the toes. So here you can see I'm holding a gray piece of foam against her hand. There's one on her palm and the one on the back of her hand. Depending on the shape of the arm and where the bony prominences are, we might use this gray foam to help protect those bony prominences. We might also use gray foam in order to create a cone shape with the bandaging. So we want the smallest circumference to be either at the hand or the foot. And then so we might use that gray foam to kind of build up and out the shape of the arm so that we know that we're going to be pushing the fluid all in one direction. You can see I put down white padding against the cotton stockinette, and that just adds as an extra cushion to protect the skin from the compressive layer. And so you can see the brown bandage that I'm applying now, that's actually where we're getting our compression from. These are short stretch bandages. They are different than ACE bandages, although a lot of people think that's what they are. ACE bandages are long stretch. So if you've ever held an ACE bandage, you know they stretch pretty far. This is a short stretch, which means it's more rigid. It's better for lymphedema because it has a stronger wall containment, which means it won't stretch. It's not going to allow fluid to build up. And in fact, the point of the bandaging is to apply that compression, and it's going to shrink the limb by pushing that fluid out. So for an arm, we might use 2 to 3 bandages, depending on the volume and how many layers we think will be sufficient. And then for a leg, this video shows me doing below the knee, but some therapists, and depending on how high the lymphedema goes, it might go all the way up to your hip. And that would take more like 4 to 8 bandages, again, depending on the size. Yeah, sometimes we'll have to do some bandaging around the pelvis or the hips in order to help keep it up. If there's breast swelling associated with lymphedema, we can also do this kind of bandaging around the chest. So you can see now I've got that cotton stockinette on her. I wrapped her toes and put down the white padding, and this is the short stretch bandage. You can see her, she was wiggling her toes. We definitely want to make sure that the bandages are still going to allow you to have finger flexion or toe flexion. And then we tape it in place. So something like that bandaging, you'd probably wear about 23 to 24 hours until the next session. So then the fourth component is decongestive exercises. So while there's no specific exercise for lymphedema, we definitely want you to have your compression on when you're exercising, because when you're exercising, the compression reinforces your skin. And so the muscle pumps that are the muscles that are moving when you're doing your exercise will help push the lymphedema up into the body while you exercise. And so those are just a couple of exercises, but you'd probably do a lot more than those in therapy. All right. So some treatment standards or expectations for therapy is that clothing should be removed. The most effective way to do manual lymph drainage is skin to skin. And so your therapist will have plenty of gowns or sheets in order to protect your privacy, but definitely want to take advantage of that skin to skin touch to get the most effective treatment. We will maintain proper skin hygiene, including nail trimming, washing, and addressing any cuts or scrapes. We want you to learn and practice and perform self-manual lymphatic drainage at home. We want you to wear that compression bandaging daily. As I said, the bandages will be worn about 23 to 24 hours and be removed at your next session. And then we'll also teach you how to self-bandage because we want you to have that skill at home. And then you should have about at least two sets of bandages that you can alternate and so you can wash and roll in between sessions, and make sure you bring those bandages to every session. Dietary changes or recommendations during therapy, we want you to avoid any high sodium meals and definitely stay hydrated. And if weight is a contributing factor to your lymphedema, we would encourage you to try to take weight loss efforts or even coordinate with a nutritionist as well. And compliance is key. The more appointments somebody misses, the longer it takes for them to decongest, and sometimes patients will burn out. So goals for lymphedema therapy is definitely to decongest and reduce the volume of your lymphedema. We want to preserve your skin integrity and prevent any infections or wounds. We want to improve any physical function, so things like your walking, your balance, your reaching, participation in your activities of daily living, being able to work and do house chores as well. We want to improve any psychosocial or emotional issues that come with lymphedema. We want to improve your body image, your acceptance, and being able to cope and manage the lymphedema. We want to help you to build balance between your self-care activities within your home and work and family roles. And we definitely want you to self-regulate. We want you to be able to self-monitor your lymphedema. We want you to be able to anticipate and prevent exacerbations of your lymphedema. And even when those exacerbations happen or those fluctuations increase, we want you to be able to self-decongest again. And overall, we really want to maximize your health-related quality of life. So as a patient completes phase 1 and starts to transition into second phase, they're independently managing their lymphedema. They might transition from daily bandages into sleeves or stockings, gloves. There's a couple of pictures right next to that line. You can see that material is thinner, it's lighter, it's more concealable than the bandages. Those would be worn during the day, and then at night they might continue to self-bandage at night, or there's specific nighttime garments that you can use, and these help reduce that swelling that might accumulate throughout the day. There's Velcro garments, and then there's foam bandage or foam garments as well. Depending on your insurance coverage and qualifications, your therapist might help you obtain a pneumatic compression pump. And so these kind of blow up with air, and some of them are getting really well made now and actually simulate the manual lymphatic drainage. And that is not to say it's replaceable. We definitely want you to do that self-manual lymphatic drainage. That hands-on, skin-on-skin manipulation of your skin is always the most effective. During this phase, we also decrease your frequency. Some clinics might discharge completely. Others will maybe follow up intermittently just to make sure that you're still managing the swelling at the most decongested state, and being able to order new garments. And if your swelling changes or your medical status changes, then we can always increase the therapy again or restart the decongestive phase, because it is, as Jen said, it's lifelong condition. So we are in it forever. Therapists will always be available to you depending on when you need them, but we definitely want you to manage everything on your own to the best of your ability, because fluctuations are going to happen with life events, medical events, even seasonal changes. So therapists will always be on your team, but we like you to be independent as possible. So my references are the courses that I have taken in the past. And my quote that I selected was, people do not come into therapy to change their past, but their future. And I think this quote is actually for psychotherapy, but I think it applies to lymphedema therapy as well, because although we can't fix your lymphedema, we can't make it go away, we can improve the lymphedema for your future.
Excellent. Thank you so much, Bethany, for that great presentation and the explanation of CDT. So we do have a question here. How do you most effectively sanitize the bandages when washing them?
So we definitely want people to use like a mild detergent. A lot of my patients will just hand wash at night, let them air dry overnight, and then roll them in the morning when they're dry. The cotton stockinette is usually what we go through the most, especially if somebody has any weeping or any open areas where the lymphatic fluid is sitting on that cotton stockinette. We'll wash it, or we'll just throw it away and replace it. The outside, the short stretch bandages can tend to get dirty throughout the day. I love to put an elastic bandage or elastic tuba grip over my short stretch bandages, because it helps them stay in place, and it also acts as like another protective layer to keep them clean longer.
Great. What kind of shoes or socks do you recommend wearing over these bandages when they're going through treatment?
So socks can be tricky. Again, I really like to use the disposable tubular bandages because they stay nice and tight and they act as a protective layer. So we'll use that as socks sometimes. And there are some surgical shoes or certain brands of sneakers that open wider. Sneakers are okay. It's when the tongue of the sneaker is sewn into the sides of the sneaker that gets pretty tricky, because that's much more constricted. I love to have people buy Crocs or like a Walmart brand Croc, some of the like styrofoam shoe, but like something cheap. And I'll send this picture to Jen and I can show everybody tomorrow. But there's a way that I cut these styrofoam shoe and put in elastic shoelaces, and it works beautifully.
Love it. Love it. Always looking for those new innovations.
Yeah.
Those the CLTs, they are creative. Someone just said, I love Crocs. I have 3 pairs. So yes, I've heard that as well. Excellent. All right. Well, thank you very much, Bethany. Appreciate you being here and sharing your knowledge and that great video. So
Thank you so much.
we will see you tomorrow.
Bye.
All right. So we are going to, again, take a short stretch and breathing break with our friend Lisa.
Welcome back. I hope you're all enjoying a fabulous morning of presentations. What I've been noticing is the more I watch and the more I get into it, the closer and closer I pull myself to my computer screen. But as I do that, my head comes forward, my shoulders start to round, my back starts to round, and everything in my posture, although I'm very intrigued in looking at the computer, is pulling me into a position that I don't want to be in. And the more we do this with the front of our body and our shoulders and our chest wall and our rib cage, remember that diaphragm muscle we talked about this morning, that muscle changes position as we pull ourselves forward, as we find ourselves moving and leaning forward to the computer screen. So what I want you to do right now is sit up nice and tall, make sure your feet are flat on the floor, pull your shoulders back, hands on your lap, and let's do 3 more diaphragm breaths. If you still need the feedback of feeling your abdomen move in and out, then you can absolutely put your hands here. So sit up tall, breathe in and fill the abdomen with air, and exhale. If you feel safe and comfortable doing 3, we're going to do 2 more. Breathe in and exhale. And last one, breathe in and fill the belly with air. And exhale. Empty all of the air out of the abdomen and out of the lungs. Now get back to that tall sitting up position. And let's work some of those muscles on the back of the spine that are stretched out, and also stretch some of the muscles along our chest wall that are getting tighter as we sit here. So with nice, relaxed breathing, I want you to bring your arms up to your side, bring your elbows back behind you, and breathe in. And as you breathe in, raise your hands up to the ceiling, and exhale and come back down. That's 2. We're going to go to 5. 3. 4. And 1 more. Breathe in and reach up. And exhale, bring the arms down, squeeze the elbows behind your back, get a good stretch and feel those shoulder blade muscles working, and then lower your hands down to your lap. And now we're going to do shoulder rolls backwards. So rolling the shoulders behind you, up, back, down, relaxed. We're going to do 10 of these. This is number 2, 3, 4, 5, 6, 7, 8, 9, and 10. We've now got the blood flowing in our upper back and shoulder area. Let's extend that blood flow into our neck. So again, we want to try and pull the chin back to get out of that forward head position. So your chin and your ears should come back with your ears directly over your shoulders. And we're just going to rotate. Look as far to your right side as you can comfortably. And back to the center. And alternating sides. That's 1. We're going to do 5 of these. 3, last one. And lastly, let's just drop our ear to our shoulder, get a stretch in the neck a little bit deeper, as far as you can go comfortably. 5 times to each side. This is number 3. Four. And last one. And we'll finish this stretch break with 3 more deep diaphragm breaths in order to stay focused for the end of the day. Breathe in and fill your belly with air. And exhale. Breathe in, fill the belly with air. And exhale. And last one, breathe in. And exhale. Feel free to get up when you need, take a little movement break while you're glued to your seat with anticipation for the next presentation, and I'll see you tomorrow.